Hello, everyone. Thank you for joining us today. I'm Michaela Thompson. I'm the Graduate Enrollment Management Coordinator for the University of Lethbridge. And joining me today is Dr. Carla Cardigan and Kristen Galicia with the Dillon School of Business. And we're going to talk today about our graduate programs in health services management. We're going to go through a presentation about both of those programs and then take any questions that you might have at the end. So with that, I'm going to turn things over to Carla.
All right, thanks very much, Michaela. So as Michaela said, we're going to talk to you today about the health services management programs here at the University of Lethbridge. Sorry. So just to give you a little bit of an overview of our discussion today, we will talk a bit about the program as a whole and some distinctive features and choices you have within the program. We'll talk about the course structure and the courses you'll take, a little bit about our instructors, the skills you'll acquire upon completing the program and what you can do afterwards. And we'll talk to you a little bit about the University of Lethbridge and our Calgary campus, what you need to do to apply, and a little bit of fee information, and then where you can get more information after the webinar. So this program is offered from our Calgary campus. It's offered jointly by the Dillon School of Business and the Faculty of Health Sciences every year. It's a cohort model, which means that you take your classes with the same group of people throughout the program. And that's nice because you get to build up some friends and build up a little social network, and it sort of gives you more support as you proceed through the program. It's part-time and it's a course-based master's. There is no thesis in this program, although there is a culminating paper at the end, and I'll talk a little bit more about that later in the webinar. The delivery mode is a compressed weekend format. This is often referred to as a blended learning approach, where you'll have a few face-to-face sessions every term, and then the rest of the time it'll be online learning. And the point of the program is to provide management skills and knowledge for practitioners and entry-level managers in healthcare. So you have two alternatives. You can do the master's degree, which is 11 core courses over 5 terms, followed by the integrated project course completed in the 6th term. There's experiential learning throughout the program, and it's designed for completion in 24 months. You can also do the graduate certificate, which is 6 core courses. Those are a subset of what you would do in the master's program. There's no project at the end. There may be fewer opportunities for experiential learning, and it's designed for completion in 20 months. So a few distinctive features of these programs. First, they're designed for working professionals. There's no intent that you have to give up your job to do these programs. They're part-time. As I've already mentioned, they're partially online, so you can structure your learning around your work schedule. There is face-to-face sessions some weekends, which may require travel depending on where you are. A second distinctive feature is that you can transition from the graduate certificate into the master's program. So if you complete the graduate certificate, then you can then do the master's and just take the additional courses, or you might be partway through the certificate, decide you want to do the master's program, and then you can just ask the program committee for the opportunity to transition. The audience for this program is either health professionals who have had a few years of work experience and would like to get into management, or entry-level managers who are already doing management work but would like to improve their skills to move up the organizational ladder. We also see this as a good program for managers in other areas outside of healthcare who are interested in moving into healthcare management. As I've already mentioned, there is experiential learning in the program. That could be through guest speakers, it could be through cases, it could be through field trips, it could be through job shadowing, it could be done in a variety of ways. And we do have small classes. Our classes have tended to be roughly 20 people, so lots of opportunity to get to know your colleagues, lots of opportunities to interact with the faculty. You're not just one face in a big room. I should note for international students that due to the part-time nature of the program, you unfortunately would not be eligible to apply for postgraduate work permits after completing the program, and we would suggest you contact the International Center before applying to this program. So the course structure for this program is typically 3 to 4 face-to-face sessions each term, typically Fridays 4 to 9 and Saturdays 10 to 3. The remainder of the classes are online, again, to promote flexibility while you're working. Because of COVID, the fall 2021 face-to-face sessions are still undetermined. They may have to be synchronous online, meaning we all meet together at the same time. We still get to interact with one another, but you would be doing it from your home using the internet rather than being physically present in the room. And what we do for the fall and any subsequent terms will depend on university policy and provincial health guidelines in effect at the time. Workload on average is about 15 to 18 hours a week for most students. It could be a bit more or a bit less depending on your reading speed and how you tend to work. So this is sort of typically what's being reported. Courses you'll take in the program. The ones in yellow you only take in the master's program. The ones in white and yellow it basically comprise the entire master's curriculum. The ones in white are the ones you take that you take if you're in the certificate. So as you can see, we cover a wide variety of skills and competencies, organizational design, which includes evidence-based decision-making, health services design, accounting, finance, leading people and teams, which includes human resources, marketing, and this is marketing specifically in a healthcare setting. How do you do social marketing campaigns like encouraging people to wash their hands or wear a mask? We have a course on strategy, power, and politics, which looks at policies and strategy issues in the healthcare setting, negotiations, conflict management, health systems, looking at global international systems and comparing that to the Canadian systems, change management, quality management, and then an integrated experience project. Let me talk a little bit more about that integrated experience project. So the idea is that you develop a paper that applies what you've learned throughout the program to a healthcare management problem or challenge of your choosing. And it could even be an issue or opportunity for the organization you work for. You'll propose one or more means of addressing that problem or opportunity, provide an implementation plan, and some metrics for assessing how well your solution works. And this idea is to integrate knowledge from across your courses. Again, whether it's org design, service design, budgeting, developing business cases, dealing with change management, negotiation, leadership, marketing, all of those things can be brought to bear. And you can also draw on relevant practitioner or research literature specific to the issue you've chosen. The idea is that you can then demonstrate your ability to apply and integrate what you've learned to a management issue the same way you would as if you were a manager, and it creates a great foundation for a portfolio that you can then show to subsequent employers. And we do encourage you to start thinking about and developing foundations for your paper from the start of the program. So what kinds of skills and knowledge will you acquire? Well, here's some examples. One, for example, is designing effective services for greater client satisfaction and quality of care. It could be competencies related to managing conflict and negotiating for effective resolutions. It would include managing change for groups or organizations. How to prepare and use a budget effectively, which comes up in many management situations. How to make lease or buy decisions for major items of equipment. Applying design thinking to organizations and solving problems, designing a social marketing campaign, for example, around hand washing or vaccinations, creating job descriptions, leading teams, assessing and improving the quality of healthcare delivery. And then in the context of your integrated project, applying all of these things to a management problem or opportunity in a holistic sense to actually address that problem and improve some aspect of healthcare delivery. So what are the opportunities when you're done? Well, the program gives you a wide range of skills that would be helpful for both private and public sector settings in healthcare. That could be hospitals, public health offices, physicians and dentist clinics, physiotherapy, public and private sector health services in general. Could be consulting, could be working for government. We should also note the skills you're learning transfer to a wide variety of management settings, not just healthcare. So for greater career flexibility, the skills you pick up, if you decide in the longer term that you do want to look at other settings, those skills will still transfer and help you. We should also note that the Government of Canada Job Bank predicts ongoing demand for healthcare managers for the next 10 years, with unemployment well below the national average. A little bit of information about the University of Lethbridge and about Calgary. The University of Lethbridge was established in 1967, so we're well past our 50th anniversary. We have about 8,500 students and about 150 undergraduate and more than 70 graduate level programs. We have been in Calgary for more than 20 years in downtown Calgary, and there are several hotels and restaurants within a few blocks of the downtown campus. So how do you apply to the program? Well, I've included here a URL for where you can apply. Our application deadline is May 1st of this year. And the kinds of information you need to provide. First, a letter of intent, no more than 500 words, giving us a sense for why you're applying. What's the nature of your interest in the program? What do you hope to do when you're done? Secondly, a CV, curriculum vitae, giving some sense of your academic background, your work experience, what awards, scholarships, or publications you may have had. And for your work experience, please do give us a little bit of a sense of what you've done and where you've done it, because we do consider work experience in assessing your application. We also look for 3 references, 1 reference from an instructor at the university level and 2 references from employers, preferably in a supervisory capacity. If there's issues in getting those particular references, please do get in touch and suggest some alternatives and we can respond to that. Unofficial academic transcripts. And finally, evidence of English language proficiency if required. And again, we've given a URL there if you want the details on what that might entail, if that's something that could affect you. Admission requirements, there's 2 routes. One is a baccalaureate degree route. So if you have an undergraduate bachelor's degree in nursing, health sciences, or management, or its academic equivalent in a discipline of interest or a closely related discipline. We are looking for a minimum GPA of 3.0 on a 4-point scale on the last 20 graded university level courses, some successful experience in the health sector, and again, if it applies to you, English language proficiency. Alternatively, if you've done the University of Lethbridge Bachelor of Management or Bachelor of Health Sciences combined degree, then we still would like a minimum GPA of 3.0 on your last 20 university level courses, but there is no experience requirement. Fees. Now I should note we do not have fees finalized for the upcoming year, so these are the fees from the previous year. But you can see for domestic students for the previous year, fees were approximately $2,800 a term. As I said, fees are still being determined for the upcoming year, and I've provided the URL there where you can check the fees when they're available. And we hope that those will be available in the next month or 2. For international students, fees per term are approximately $6,440. Again, that was last year's fees. Fees are still to be determined for the coming year. Same URL to check for finding out what those will be. And last but not least, if you have questions and we haven't addressed them in what we've talked about, please go to the webpage shown there, go.uleth.ca/HSM, or email us at hmanagement@uleth.ca. Thanks very much, and I'll turn it back to you, Michaela.
Thank you, Carla. That was wonderful. I do have one quick question. What is the best way if somebody is wondering if maybe they don't quite meet the admission requirements or they have a question about their background or particular career path? What's the best way for them to get in touch with you guys to start that conversation?
Great question. And the email address we have there, hmgt@uleth.ca, would be a terrific place to start with. email us with your questions and your specific information, and we'd be happy to respond and give you some ideas on how to proceed.
Perfect. Well, thank you very much. I think we are just about ready to wrap up. Kristen, did you have anything that you wanted to add?
No, nothing right now, Michaela, but absolutely, like everyone said, just touch base with us and we're happy to answer your questions anytime.
Great. Well, thank you very much. Thank you everyone for joining us today. Please reach out if you have any questions at all. I hope that we see you either in the upcoming fall term or a term very close to that, if not this year. And please reach out if you have any questions. Thank you, Carla and Kristen, for your time today, and take care, everyone.
Thanks, everyone. Bye.
Thank you. Bye-bye.